Public works or construction employee, you face a serious hazard when working in confined spaces. There is no room for error in confined space entry. Confined spaces can be found in many familiar forms, such as manholes, vaults, pipelines, storm drains, tanks, and in some cases, trenches, or any work area with one or more of the following conditions can be classified as a confined space. 1. Quality of the atmosphere within the space. If existing ventilation is insufficient to remove contaminated air or creates an oxygen deficiency, it can be classified as a confined space. 2. The ability to rescue a disabled worker in case of emergency. Can you safely and easily rescue a disabled worker? A rescue would be easier through a side opening, as opposed to climbing up the side of the tank. Either one of these two conditions can render a space a confined space. The first rule is never enter a confined space without permission or an entry permit. If a permit system is used, be sure to post it at the job site to warn others that you're inside. Before anyone is allowed to work in a confined space, they must be trained in risks and hazards that may be encountered. Oxygen deficiency is a lack of oxygen or oxygen levels that are too low to sustain life. Normal air contains 21% oxygen. Levels below 21% impair your thinking and acting abilities, and below 16%, permanent injury or death can occur. Lack of oxygen is extremely dangerous, as it causes you to become drowsy and keeps you from realizing you're in danger. Carbon monoxide may be present from the exhaust of vehicles or other motors used in and around projects. Care must be used when operating ventilation equipment to make sure the exhaust of gasoline or diesel-powered motors doesn't enter the ventilation system. If there is an explosive atmosphere, always avoid open flame, sparking, or other sources of ignition. Carbon dioxide, caused by rotting vegetation, may also exist in confined spaces, such as manholes or storm drains. Concentrations in the area of 8 to 10% can cause severe headache, blurred vision, and loss of consciousness after 5 to 10 minutes exposure. Hydrogen sulfide is one of the most dangerous and toxic hazards you may face. It smells like rotten eggs, and a few breaths of the gas can deaden your sense of smell. Marsh gas, or methane, is generated by decaying matter. It's usually odorless and is an asphyxiant, since it pushes out the oxygen in a confined space. Methane is lighter than air, so it's usually found at the top of the confined space. Sewer gas at the bottom, methane at the top. This reinforces the need to test the air at all levels of the space before entering. If these hazards weren't enough, there's more. How about noise levels in an enclosed area? Heat exhaustion and cramps are common. Exposure to chemicals, solvents, or residues that can irritate your eyes or skin. How about falls from climbing ladders? Ladders over 20 feet high require fall protection. Quite often, falls occur due to sudden acute exposure to respiratory hazards. Usually odors, oily residue, or unfamiliar conditions may signal a problem. Illegal dumping of hazardous waste may be found in storm drains, manholes, and sewers. Be sure to consult your supervisor if you're not sure or have any questions. Once you've tested for appropriate hazards and tests are within normal or safe limits, you're ready to go to work. Let's quickly review the basics of confined space safety. Always follow your organization's policies and procedures. Never enter a confined space without permission and training. Leave the area immediately if you feel ill, such as dizziness or lightheadedness. Never smoke in or around confined spaces. Test the atmosphere for hazardous gases or oxygen deficiency. periodically retest and monitor the air. Confined space entry can be a safe job, but how safe depends upon the team, the training, and the rules. Thank you.